Americans. But 8 governors, including one of those at the White House today, Oklahoma Republican Governor Mary Fallin, are rejecting the offer, concerned that their states may have to foot the bill down the road. The president was sure to have some thoughts. Following their powwow at the White House, the 6 governors are on to meet with House Speaker John Boehner and Senate Majority Leader Harry Reid this afternoon, who are also sure to have some thoughts. Joy, the Medicare question is really interesting in terms of how the governors play this one, insofar as if you're a Republican governor, you're offered the federal government says it's going to cover, I believe, 100% of the cost of expanding the rolls from 2014 to 2016, and basically between 95 and 90% thereafter. Right. To say no at this point, when Americans are hurting, we know that we're coming out of a deep recession, but you have 21 million people who could be offered health care. Right. It's a very difficult position for them to be in, to say no, mostly on ideological grounds.
Right. And I mean, I think it really depends on not only how many uninsured they have in their states, but how strong the hospital interests are in their state and how far they're willing to go to allow hospitals to essentially be bankrupted, because they're still going to have to care for those patients. So I suspect states like Florida will take the money.
Ezra, you're still with us here. Governing at the state level or being a Republican at the state level is often very different than being a Republican on Capitol Hill in terms of the ideological purity test. What's notable to me is you're going to have some Republican governors that are probably going to accept the expansion of the Medicare rolls. And you also have Republicans saying things like, we need to look at shared sacrifice after meeting with the president. I mean, there is a difference when you are sort of in touch with your constituents at the state level versus someone that's sequestered in Washington and subjecting yourself to GOP litmus tests.
Well, sometimes there is, and sometimes there's Rick Scott in Florida, so it can kind of go both ways on that. I think that what is notable is that, and it goes to something Joy said, these folks are going to get an enormous amount of pressure from their medical industries in their states. I mean, the hospitals are going to be killing these governors who are not going to accept the Medicaid portion, because there's a dimension of the health care bill that begins to ratchet back the money we currently pay, the money the federal government currently pays hospitals to pay for to cover uninsured people. We're ratcheting that back because we're going to be insuring them, and we're going to be insuring them almost entirely at federal expense. But if you're a state like Florida, say, and you refuse to take the Medicaid money, it's not just that your hospitals aren't going to get the relief from their current uninsured costs, it's that they're going to get hammered on what are called these dish payments, and they're not going to like that at all. One other just quick thing that I find amazing about this, if you look at a list of what states have the largest percentage of the uninsured, it's mostly red. I did this while ago. 7 or 8 out of the 10 were red. The top 10 most insured are almost all blue. The Affordable Care Act, in a very big way, is a large transfer of money from blue states to red states. A state like Texas or Florida that is relatively meager Medicaid now is getting an enormous federal subsidy. So to reject a deal that is that good, you might be able to do that for a year or 2 years while you're hoping to be able to run in 2016. It's not going to go on for much longer than that.
Well, Aaron, Rick Perry has made lots of questionable decisions vis-a-vis expanding health care coverage, or even, the Planned Parenthood debate was, I think, a very powerful one in that it showed how far a Republican governor was willing to go to deny women basic health care coverage on ideological grounds.
Absolutely, and I think that, in fact, the Medicaid expansion decision, the part of the Affordable Care Act Supreme Court decision that opened up the door to allow the governors to refuse it, might also make it easier for states further down the line to reject Planned Parenthood funding, or rather reject the terms that the federal government is suggesting to them. So that is a whole brave new world. And then in terms of these governors, standing up and saying that they don't want to be part of the Medicaid expansion, one thing that is very troubling that you're hearing right now from healthcare wonks is saying that this is actually kind of sabotaging the system. It wasn't set up to have the federal government step in and do this. They were trying to give the states more control. So a kind of open question is, if these governors stay recalcitrant, are they intentionally going to set the system up to fail? And then they kind of get what they want.
That seems to be part of whether it's setting up the exchanges, which is to sort of dismantle Obamacare or make it that much more difficult to access it, or just, rejecting the expansion. Ari, there has to be some, the question is how much they're held accountable for doing this by their constituents.
Right, and I think this actually goes to a cynicism that Grover referred to in his interview with you, where he said, well, people think that if we raise taxes on the wealthy, that eventually it will result in higher taxes for them. And part of the idea here is, well, people think that if we can challenge this form of health care distributed, as Ezra reported, with very, very good margins for these states from the feds, that eventually we can undermine the system. It's just a deeply cynical view about how government benefits work and how we share the sacrifice. I think, though, to the point, it can work in the short term because I don't know that people are super informed about why they're not getting health care.
Well, and Ezra, as you point out, a lot of these states that are rejecting, that are sort of throwing the exchanges for a loop, which is to say not setting up their own exchanges or denying the expansion of the Medicare rolls, are ones where they have incredibly high rates of the uninsured. Texas is, I think, is #1 in the country with almost 25%. Unfortunately, we have to leave it there, my friend. But thank you for staying on with us, the Washington Post's Ezra Klein. Thanks, as always, for your insight and wisdom.
Thank you.
Coming up, 2012 has been a banner year for same-sex marriage at the ballot box.